could take Duffy and then the two of you for discussion. The next speaker is Duffy MacKay, Dr. Douglas MacKay, who's Senior Vice President of Scientific and Regulatory Affairs for the Council for Responsible Nutrition. And there, Dr. MacKay oversees CRN's Science and Regulatory Affairs Department, ensuring that the association's scientific policy and legislative positions are based on credible scientific rationales. His expertise combines a practical knowledge of the industry and regulation and scientific product development with hands-on experience as a medical practitioner. He's a licensed naturopath physician who still sees patients on a part-time basis and previously was owner and practitioner in New Hampshire of a complementary and alternative medicine private practice. And it's been my pleasure to get to know you, Duffy, for about a year now, and we're lucky to have you come and speak to us.
First of all, I just want to thank Johanna and Sylvia. It's been a really dynamic and fascinating. I hope everybody else is excited about the content. And from my perspective, it's been very holistic. We've talked about the brain, we've talked about the gut, we've talked about the mouth. I mean, this is really, if we added a little mind, body, and some sleep and fun to this, we would have a real holistic approach to aging. But I'm going to try to stay focused in my area of work right now. And I want to echo Tim's message. I mean, industry is one small piece of this puzzle. We need to have the same title and replace industry with regulator, academic, research community, policymaker, educator. Everyone has a piece in this equation of what can we do to promote healthy aging. I'm going to quickly review some of what we know about nutrient gaps. And let me back up a second. I do want to underscore, I do work for the dietary supplement industry. I represent the manufacturers of finished products, as well as the ingredient suppliers, the people who make the vitamins, the minerals, the omega-3 fatty acids. And so my talk is really going to come through the lens of that industry. And I recognize food first. The whole industry recognizes we need to get people to eat better, more vegetables, more whole foods, whole grains, etc. But we have to recognize that when we see those dramatic deficiencies, the practitioners in the world, the people where the rubber meets the road, need additional tools to help reach targets. We have nutrient targets for a reason. We cannot ignore the fact that certain amounts of folic acid and iodine are important at certain stages of life. And if someone's not getting it from diet alone, there is a role for responsible supplementation. So again, nutrient gaps across the lifespan. What do we know today? What is the role of supplementation in a healthy diet, in combination with a healthy diet? What is industry's efforts currently to promote healthy aging? Those will be limited to things I've touched as an industry representative. I'm sure there is much more going on out there that I am not aware of. And then a little bit of the responsibility of the industry. How do we manage consumers' expectations around the magic pill, reverse aging, stop aging now, and a little summary. So nutrient gaps across the lifespan, what do we know? So we do know we have 11 key shortfall nutrients. So these are nutrients where when we look at the entire population, adults 2 and over, the great eaters, the poor eaters, everyone lumped together, we have 11 shortfall nutrients. Iron, of course, is limited to the premenopausal females. Within that, we have 5 nutrients of public health concern. So these are things that are underconsumed to a degree as well as associated with negative health outcomes. So these are things when we see those nutrient gaps on those graphs, there are consequences to these nutrient gaps. So if you're banging the drum trying to get someone to eat better, or they have no teeth and can't do the vegetables and fiber, you need to come up with a solution because there are consequences to these shortfalls. When we look at our aging population and older adults over 71, we see the same shortfalls, but we see dramatic numbers of people falling short. With 70 to 80% when you look at men and women for calcium, vitamin D, 93% of men and 97% of women below the EAR. These are significant numbers, and we can all talk about the reasons. Fiber, the consequences, the bathroom for old people is an experience. You know, I've worked with this, getting people to stay regular. It's a key component of health. Potassium, of course. So I realize all of those numbers are based on intake. We also have evidence related to biomarkers. So if you look at the CDC Second Nutrition Report, we see similar significant shortfalls in the population. And these are meaningful numbers of people, and the prevalence deficiency has not changed dramatically. So again, as a practitioner, someone that's giving information, you have to meet the patient where they're at. And if the DASH diet or the Mediterranean diet's way over here for them, you need to come up with solutions today where you can help them meet those targeted nutrient intakes. Something I'm very interested in, you know, maybe everyone doesn't agree about the impact of long-chain omega-3 fatty acids, but when you look at the globe, red is the lowest category, meaning our serum, this is based on serum levels, below 4% EPA DHA in the serum, and we're on par with countries at the lowest levels here. So again, whether you're going to eat anchovies and sardines like I do, or whether you're going to consider supplementing long-chain omega-3 fatty acids, there are reasons to get the recommended levels. American Heart Association has targets. There's global targets put out there around the world. These are things that should not be ignored. So what is the role of supplemental nutrients in a healthy diet? So when you look at the reasons people take supplements, and this comes from a work of Reagan Bailey, you look at the top 3 reasons. And so I put this slide up here because a lot of people have this concern, especially when you get to the dietitian community, that we're not so comfortable with supplements because we're concerned people will do that instead of eating well. But when you look at the supplement user and you ask them why they're using their supplement, their number 1 reason is just to improve overall health. To maintain health and stay healthy, i.e., I want to reach those nutrient targets because I think they're important, and then to supplement the diet and fill nutrient gaps. They're not saying, I'm taking these because I don't like vegetables or because I think if I take this, I won't have to eat well. The supplement user, if you look at their profile, they tend to visit their doctor, they tend to not smoke, they tend to eat a healthier diet. So again, the real challenge of the industry is getting the supplements into the hands of the people who need them most. So let's look at the idea of what is the role of supplementation. So if we look at, this was a study done in 2011, so it's a little older, but I think it's still representative. What are the intakes of these foods? So these lines represent people falling below the EAR for the nutrients. I've already put up some of these numbers. You see vitamin D, most people falling short. So this is food alone. When you add fortified foods, so foods with nutrients added, fortified milk and things, you show that it helps another portion of the population reach their targets. And finally, with supplements, you see that it reaches a greater number of people, helping them to reach their targets. So then you say, well, what about going over those targets? So when we look at this graph, this is again looking at the same set of data, but on the left you see those are percent below the EAR for certain nutrients, and, excuse me, those are percent meeting the EAR for certain nutrients. But the other side of the graph is why I put this slide over there. This is, the left side is the food alone, and the right side, for my right over here, is above the UL. And so you can see food alone is not taking very many folks above the UL, but some supplement users do tip above the UL on some of those nutrients. But what is the consequences? You know, we're not seeing any dramatic consequences and not dramatic numbers of people going above the UL. Prenatal multivitamins. Here is a sensitive subpopulation with rock-solid data for reasons they do not want to fall short in at least these 3 key nutrients. These are nutrients at a time of life where there are consequences, well-documented consequences of these shortfalls. We know that for iron, and this is a tricky one because 50% of pregnancies are unplanned, and you want to have these nutrients at the target levels when they get pregnant. So really your target population for something like this is any young woman who might be planning or thinking about becoming pregnant, and the other 50% of them who were not thinking about becoming pregnant. So iron, a nutrient of public health concern for women capable of becoming pregnant. consequences for the offspring as well as a healthy pregnancy. Folic acid is interesting because you remember the recommendation for folic acid is not just to meet the target levels. There is a recommendation to take 400 micrograms of synthetic folic acid daily from fortified foods and or supplements. So again, the folic acid recommendation for neural tube defects is specific to supplemental folic acid. Iodine. There is a cluster of concerned physicians, including the American Thyroid Association, the Endocrine Society, the Teratology Society, the American Association of Clinical Endocrinologists. They're seeing a subchronic insufficiency of iodine here in the United States, and they all have policy statements that say they recommend that all U.S. women take a prenatal, well, all pregnant, U.S. women take a prenatal vitamin that contains 150 micrograms daily in the form of potassium iodide. So again, 3 key nutrients that a multivitamin can provide. When we're thinking about older adults, 2 little additional nutrients that came to my mind. Protein, while it's not a shortfall nutrient, we're seeing this emerging evidence of the benefits of higher than RDA intake levels, especially for older adults, especially for hospitalized and recovering from injury, and this whole notion of accelerated rates of sarcopenia. Vitamin B12, another one, not a shortfall nutrient. We consume enough B12, but for those who get atrophic gastritis and they're not able to absorb it as well, 1 dietary guideline ago, they included the recommendation to include foods fortified with crystalline B12 or take a supplement. So again, if you're seeing it on a lab value and you know the person's eating healthy, it may be where supplements are important nonetheless. This is just to show, again, the role of supplements. Here is the calcium shortfall I showed earlier and the improvements when you look at the same data with intake of supplements. More dramatic for vitamin D, where you're seeing almost no one meet the EAR, and then about half of the people meeting the EAR. So again, this is the lens of the supplement industry. We're hearing the science that significant portions of the population have inadequate intakes. We know that supplementation, again from the science, is a safe and practical means. So what is our role to support healthy aging? Well, it's to promote the responsible use of these products in addition to healthy diet to meet your nutrient needs. So 2 variations of that approach. One, we approach it from the population level, and one, we approach it from the individual level. So first, I'm going to get a little bit into the population approach, and again, this is what I've experienced being a representative of the industry. Earlier in the conference yesterday, someone had mentioned the wisdom of speaking the economic language. Getting the economic justification, what would the impact of these products be on the population? So we've invested in a series of healthcare cost savings analysis, taking the data from the scientific literature, giving it to these folks that do these economic analysis, very sophisticated, and then estimating what the healthcare cost savings of achieving targeted nutrient intakes for certain disease conditions like bone health and calcium and vitamin D. We have advocated in past cycles, and we plan to advocate again, that those in greatest need with food assistance tend, when you look at the data, have the biggest nutrient gaps. So the wisdom of allowing a multivitamin or other nutrients to be included in our supplemental nutrition assistance programs. Or, again, the strong data for pregnancy, WIC participants and WIC-eligible participants being able to have the choice to include a prenatal multivitamin in their collection of assistance. CRN was approached by the collection of physicians concerned about iodine intake and their recommendations to have 150 micrograms of iodine in a prenatal. They were a little flabbergasted to find out that every single prenatal did not contain that level of iodine, and there was no requirement to do so. So we set an industry guideline that anyone marketing something for pregnancy and lactation that's a multivitamin would contain the adequate amount of recommended amount of iodine. We're just running a study now to see the impact of that guideline. Again, it was mentioned for a population approach, who puts those giant scientific dossiers together for a health claim or a qualified health claim, or it's guys like me and my colleagues in industry that say, wow, it looks like the science in omega-3 has grown. Can we get an expansion of that health claim for omega-3s? There's industry efforts to look at magnesium. Is there a potential for health claim for magnesium intake and blood pressure? So again, this is industry putting its resources towards a public health message for getting adequate levels. And of course, around the globe, we have the most extreme examples where either a mono diet or food issues create significant shortfalls with things like vitamin A and blindness. And our industry is avid supporters of things like vitamin angels that donate their time, money, effort to get these products into the hands of these humanitarian organizations so they can make a difference around the world. And then, of course, the individual needs. How do we approach the individual? Well, this is kind of a no-brainer. It's our products. We make science-based products that follow the science for individual age and gender categories. So a multivitamin for pregnancy is going to be based on the nutrient needs of that cycle. We have ones that are for women still menstruating that include iron, but then, of course, when they're done menstruating, they don't include iron. So these are the kinds of ways we approach the individual needs. We also have all these interesting diets out there that people are doing, and we have products that can help them make sure they meet these target nutrient intakes. Vegan sources of long-chain omega-3 fatty acids, things like that. We talked about oral health. People don't like to swallow pills. People choke on pills. There's all sorts of creative delivery forms that the industry has innovated: powders, liquids, gel caps. So these are ways that we try to meet the needs of the individual to help them get everything they need. I'm going to move on. Okay, so managing consumer expectations. You cannot ignore the push towards sensationalism with aging. So how do we deal with this? We have consumers looking for pain relief, avoiding Alzheimer's, and we have significant consumer education. We emphasize there is no miracle pill. It sounds too good to be true, it is. And always speak with your physician. The potential for interactions is there. We need to be having an open dialogue. And we also put our money where our mouth is, and we have a supplement advertising review program. This has been going on for over 10 years. It's run through the Better Business Bureau. They have attorneys there that we pay to evaluate supplement advertising and challenge that advertising, force them to provide the substantiation for that advertising, and if it's not adequate, change it. We put it outside of our control, but we fund it. So in summary, the evidence demonstrates inadequate nutrient intakes. Supplements responsibly used with a healthy diet can help you meet all your needs. And a lifetime of nutrient adequacy is our goal because we feel that supports healthy aging. We advocate for supplemental nutrients to be included in federal nutrition programs and policies. We set in science-based guidelines. We market products to meet individual needs. Thank you.
Right on time. Thank you so much.